Okay, welcome to Child Psychology. We're going to continue with our Chapter 4 lecture. This is going to be our Chapter 4 lecture part 2. So let's continue. We talked about the ovulation and the female menstrual cycle. We talked about prenatal development and the birthing process. So now we need to finish up and talk about some related things. Some of you may recall that not all zygotes will implant, and then not all embryos will make it basically to birth. So just to review a little bit, some of these things were mentioned already. Let's review vulnerability during prenatal development. So during the germinal period, first 14 days, I mentioned before that only about 40% of zygotes achieve implantation. So basically about 60% of conceptions will fail to grow or implant properly. So right from the beginning, only 40% make it. So they don't survive the germinal period. And most of these organisms are grossly abnormal. A lot of abnormalities there, genetic, chromosomal. So these zygotes are rejected by the body. The embryonic period, 3rd to 8th week, there's also some chances there that the embryo won't make it. About 20% of embryos are aborted spontaneously. Most often because of chromosome abnormalities. Again, because of abnormalities, the body will reject those embryos. So another 20% gone during the embryonic period. Fetal period from 9th week until birth. There's less chance there that the fetus will be rejected, but about 5% of all fetuses are aborted spontaneously before the age of viability, before 22 weeks, or are stillborn. So they're born lifeless, and that is before 22 weeks. In all, only about 31% of zygotes will grow and survive to become living newborn babies. Only 31%. Okay, so right from the beginning, the odds were against you. And remember, when we talk genetically, you are absolutely unique. Okay, so this makes you even more unique. Let's keep going. Now, potential mothers or mothers during the birthing process will need some type of medical assistance. Okay, so drugs are usually part of the birthing process, at least in the U.S. In most countries, but especially the U.S. Okay, most women who are undergoing labor will receive an epidural, which is basically an injection. It's something that basically reduces pain, because I hear that giving birth is extremely painful. How painful is it? Well, one comedian joked that if men want to find out how painful it is for women to give birth, that they should take their upper lip and fold it over the top of their heads. That's what she said. I know that was meant to be funny, but you know, just to illustrate that it is very painful. But most women will get you know, an epidural to reduce that pain. And then they might also receive another drug called Pitocin to help induce labor if it hasn't already started. If it's time, but labor is not beginning. When it comes to the rate of newborn survival in the world, about 1 in 70 will die, you know, during the birthing process. So 1 in 70 won't make it. That number is higher in poor nations, you know, for obvious reasons. You know, medical care is not as good in those places. There are more stresses, there's more problems in those places. 1 in 250 die in the US, okay? 1 in 250 will not make it in the US, okay? Now that's a lot better than the average worldwide, but there's 40 other countries that have a better rate than the US. The US, though a very rich country, has a lot of inequality, and of course, outcomes are better for those that are well off than those that are poor. So I'm sure that it's those that are at the bottom of the economic ladder that probably suffer more from this. And this chart that you see here, that's maternal mortality. So sometimes it does happen that the mother will actually die during birth. Okay, and you can see the rate here, the ratio per 100,000 live births. So you can see how it's varied throughout the year, starting in 1990. Okay, and that only goes up to 215. But you can see the chart for the US there, 1990, about 12 births for every 100,000. So about 12 mothers would die for every 100,000 that would try to give birth, that gave birth, okay? And it went up during 2003, and then has been coming down steadily since then. But look at all those other countries that are below the US, all those other countries that are doing better than the US. There's more maternal mortality here than other rich countries. And why is that? Well, like I said before, the fact that there's a lot of inequality here probably has something to do with healthcare. Varies a lot here. If you have good healthcare, bad healthcare, if you're high income, low income, all that. In this country, money says a lot. Money matters a lot. Money will affect everything in this country. In other countries, not so much. Well, it does in other countries too, but in other countries, there are some important differences. You know, they actually have, in some of these countries, healthcare for all residents, regardless of income. I know here in the US, they tried to pass that law, and they've been, and it got passed, but they've been fighting it over since. One side has been fighting over since and trying to get rid of it, saying that it makes it healthcare more expensive, whatever reason. But yeah, if you want equality, I guess in one place we should have equality, it should be healthcare. Let's keep going. All right, so let's talk about the newborn then. So you have this newborn, this baby that has been born, and you need to determine if this newborn is doing okay. So there are neonatal assessment techniques that are used. Neonatal just means it has to do with the newborn. A neonate is a newborn. So neonatal assessment techniques are techniques that are used to assess the newborn, to see how the newborn is doing. And a very common one, a very important one that's used is called the APGAR scale. The APGAR scale are measures that are taken, you know, between at 1 and 5 minutes after birth, and could even be taken several minutes after or sometime later, depending on what the score is. But it's a scale from 0 to 2. If the child gets a 0, that means that there are severe problems. If the child gets a 2, that means there's no problems. A 1 means it's somewhere in the middle. It's not perfect, right? There are some issues, but it's not the worst either, okay? And they look at 5 different things on this scale. One is appearance. What does the baby look like? Does the baby have a rosy complexion? That's what you want. That indicates good blood flow. You know, if the baby looks good, they would give the baby a 2 on that scale. If the baby looks kind of gray, you know, blue, that's not good. That usually means a lack of oxygen. That would be a 0. A 1, well, you know, would be somewhere in the middle. And I'll give you more details in a moment. They also check the baby's pulse, right? If there's no pulse there, obviously that would be a 0. If there's a good pulse, that would be a 2. Somewhere in the middle is a 1. Grimace, reflex irritability. A grimace actually is an expression of displeasure on your face. So when infants are born, when you have a newborn, they should have some kind of grimace indicating that they're unhappy, they're crying, perhaps screaming or something like that, because you know they just went through the birth canal, or you know they've just been born. So if there is no expression, that's really bad. Okay, that's a 0. If the baby is crying, you know, and looks to have an expression of displeasure there, then that would be a 2. Somewhere in the middle is a 1. Activity, how active the baby is, that has to do with whether the muscles are flexed. Okay, if the muscles are flexed and there's good muscle tone, that would be a 2. If the baby is limp and lifeless, that's really bad. That's a 0. Somewhere in between, right, is a 1. Respiration, Okay, well, absence of respiration is a 0, good respiration is a 2. Of course, you could be somewhere in the middle, weak respiration. If you add up the scores for those 5 areas, those 5 things, right, you can get a maximum of 10. So if the total score is between 7 and 10, that's considered normal. Okay, that's where most babies score. A score of between 4 and 7 means that, well, there's some intervention required. They may not give you the baby right away. They might have to do some things to ensure that the baby's going to be okay. Score of 3 or less, total score of 3 or less means the baby is in critical condition. It may not survive. And of course, they will intervene and they will do all they can. But that's really bad. Okay. Now, let's look at this a little bit more closely. I kind of said these things already, but here it is in a chart. So you can understand a little bit more. So the first thing on the chart there is appearance. If the appearance of the baby is blue-gray, pale, that's bad. That indicates lack of blood flow. Baby might be lifeless, okay? If the appearance is, blue-gray, pale, that's not a good color, okay? That would be 0 points. 1 point would be the baby looks normal color, except for maybe the extremities, maybe the tips of the fingers and toes could be a little bit bluish. That's 1 point. 2 points, the baby has a normal color all over the body. Okay, and that usually what we mean is a rosy kind of complexion. Okay, that shows that there's blood flow. Pulse, if there's no pulse, that's a 0. If the pulse is below 100 beats per minute, that's 1. Above 100 beats per minute, that's 2 points. Grimace, reflex irritability. If there's no response, right, no expression on the baby's face, that's bad. That's a 0. If there is some grimace, some look of displeasure, that's 1 point. Even better is if the baby is sneezing, coughing, crying. Usually they're crying. That's 2 points. That indicates that the baby is alive and doing well and did not like, the birthing process and, it's stressful. Activity, that's muscle tone. That usually refers to muscle tone. When the baby is born, if the baby is flaccid and limp, basically that would be like a cooked piece of spaghetti or a rope. They are limp, they're flaccid, which means they're wobbly and all, well, like a piece of cooked spaghetti. That's not good. That usually indicates the baby is unresponsive and lifeless. If the baby is weak, inactive, that's 1 point. But if the baby is strong and active, has those muscles flexed, that would give the baby a score of 2. Let me show you an image so you understand. Let's go back to an image over here that I showed you guys before. This image over here, it's not a very good image, but look at the baby on the right there. The muscles clenched there. You can see the baby's muscles. That is a baby that would get a 2. The other one also doing okay, but certainly not as, doesn't have as much activity, as much muscle tone as the one on the right. But they probably both get a 2. They're both doing okay. Now there was one more thing here with the Apgar scale. Respiration, if it's absent, that's a 0. Baby's not breathing. Okay, if it's slow, irregular, that usually means the baby's weak. That's 1 point. If there's good respiration, the baby's crying, that's 2. Usually if they're crying, it also means they're breathing. So that's the Apgar scale. That's one of the assessment techniques that they use to see how the baby's doing. And if the baby's not doing really well, of course, they will intervene and do what they can to make sure the baby gets better. And they may not be able to give you the baby right away. I do want to point out also that though some babies may not be doing that great at the beginning, maybe they score somewhere in the middle. As the hours go by, they will get better. So when the baby isn't doing that great, they will assess at later times. And what usually happens is with their help, with their intervention, the baby gets better and then we'll get a higher score later on. But a score of 3 or below is usually indicative of, severe problems. Let's talk more about birth. Now there are complications during birth. Usually you want the baby to come out, head first. But there are complications. You can have what's called a breech birth, which means the baby is born feet first, or buttocks first. And well, that can be a lot more painful, a lot more dangerous for the baby. okay? And for the mother. So they might have to do a C-section, which is another complication. With a C-section, basically they make an incision, they cut you open, and they remove the baby that way. About 1 out of every 3 babies in the US is born via C-section. Less in poor countries. Good news about a C-section is there's less trauma for the newborn. It's a lot easier on the newborn, but a lot worse for the mother. You know, they have to cut you open, and it's going to take you a lot longer to recover from that. And you're going to be in pain for a lot longer. You're going to be on some very strong medication. It's going to be hard for you to hold your baby because they will have cut your muscles and your abdomen to get that baby out. But 1 out of every 3 babies is born via C-section in the US. Why is that so high? A lot of experts believe that's too high. It could be for convenience. When you have a C-section, you can schedule it and say, I want the baby, I want to have the C-section at this time. And that's when the baby is going to be born, basically. No surprises, basically. And when women have 1 C-section, they're usually, they're likely to have another one the second time as well. That's what happened to my wife. She tried to have my daughter the usual way, and it didn't work. I guess my daughter's head was too big, my wife is too small, or didn't dilate enough or something, and she pushed and pushed for like 8 hours. The doctor wasn't even there at the time. The nurses were helping her. The doctor got there late, and when the doctor finally got there, he saw what was going on and said, well, she needs a C-section. And that's what happened. The baby was born that way. So my wife got to experience the pain of trying to push and of the C-section, okay? Although there is, they did give her, medicine for that, or, what is called analgesics, which reduce pain. But she got to feel a lot of the pain because those things don't kick in right away, okay? And then when my son was born, our second child, figured that it was not going to be possible again. And we just scheduled the C-section. My wife has slight cerebral palsy, which means she has some damage to the motor cortex in her brain, and which means that impairs movement. And that probably has something to do with the fact that she wasn't able to have the baby naturally. Okay, so yes, 2 C-sections. And then no more babies after that. Not planning to have another one. My oldest now is going to be 10 soon, like in a month. And my youngest, my son, is going to be 8. So they're like 2 years apart. Okay, no more. Okay, it was, it's been quite an ordeal with them. Cerebral palsy, like I mentioned, my wife has slight cerebral palsy. Cerebral palsy, like I said, is when there's damage to the brain. It could be on the right side or the left. If there's damage on the right side, then there'll be problems with movement on the left side of the body. If the brain damage is on the left side, there'll be problems with movement on the right side of the body. If the damage is on the right side, then there'll be damage on the left side of the body. There'll be problems with movement on the left side of the body. I'm not sure if I said the same thing twice there, but yes, damage on one side causes problems with movement on the opposite side of the body. That's the way movement works in the brain, okay? Cerebral palsy, so it damages the motor cortex. That makes it difficulty controlling movement. It's often due to anoxia, and anoxia is lack of oxygen, and that can cause brain damage, which is why, sometimes if there's a difficult birth, they have to do an emergency C-section because the umbilical cord might be wrapped around the baby's neck, or the birthing process is very difficult and the child is being deprived of oxygen, being suffocated. And the longer that happens, the more of the brain damage, the more severe the cerebral palsy. But cerebral palsy can also be caused by other things. Or there's other things that make it more likely, certain genetic abnormalities, and also smoking by the mother makes cerebral palsy more likely. Probably something to do with the fact that smoking probably affects the flow of oxygen to the baby. And with my wife, that was probably the issue. Her mother smoked, when she was pregnant. She was so addicted that she didn't want to give it up, didn't even try, okay? And some women will brag that, yeah, I smoke with all my sons, with all my children. Look, there they are, they're fine. When you smoke and you're pregnant, the chances of having things go wrong increases. That doesn't mean it always will. but you're putting your, your children at risk if you smoke while they're developing inside. Other complications, babies can be born what we call low birth weight. If the baby is less than 2,500 grams or less than 5.5 pounds at birth, they are considered low birth weight. There's been a steady increase of low birth weight in the US over the past 25 years. Why is that? Well, there might be several things that can cause problems. We'll talk about what those things are called. Okay, but there's been a steady increase over 25 years. There's been a few greater and greater percentage of children being born low birth weight. 8% of newborns are seriously underweight. Okay, and they're more susceptible to teratogens, which we'll talk about in a moment. Higher risk of having higher risk that the birth won't go well. A lower survival rate because they're low birth weight. They might also be premature, which we'll talk about. That's a separate thing. And they're less able to survive when they are born. They're less ready, to survive. Very low birth weight is under 1,500 grams. That's 3 pounds, 5 ounces. Less than that, and that's very low birth weight, which is even more dangerous. Extremely low birth, under 1,000 grams, 2 pounds, 3 ounces. The risk just increases dramatically the lower and lower the birth weight. But I've heard of some miracles, where children are born, just slightly over 2 pounds, and they're a critical condition at first, but they do the interventions that they do, and some of them make it. But the chances of survival are greater, actually, the more the baby weighs. Okay. Now, being preterm is a separate thing. Being preterm means that you are actually born too early. Low birth weight means that you don't weigh enough. Okay, when you're born. Preterm means you were born too early. Now, those that are preterm, those that are born too early, may or may not be low birth weight. You can be born early, but be at the normal weight, or you can be born early and be low birth weight. It just depends. Some babies weigh more than others. Some are bigger than others. So preterm babies, the ones that are born early, they are slower to talk. They take up a little bit longer to talk. They're born a little bit early. And there's also small for gestational age, or SGA, right? That means that their birth weight is less than they should be given their term. So let's say they're born full term, but they're too small. They don't weigh enough. That would be small for gestational age. Or they can be born preterm, be born early, and given the number of weeks, they don't weigh enough. Okay, that would be small for gestational age. So they're too small given the age of development. They should be a little bit larger and weigh a little bit more. Okay, it's often due to mental illness that sometimes indicates that there's problems. Okay, or the mother using drugs, using psychoactive drugs like tobacco. Tobacco, basically smoking, accounts for 25% of low birth weight. Now, the use of tobacco, smoking has been going down over the years. There's been quite a campaign to attack the tobacco industry and cigarette use in general and get people to stop smoking. They have passed a lot of laws making it illegal for people to smoke in restaurants, even public places where people gather. So basically in California, about the only places you can smoke here are, in your own home. And that's assuming that you don't have children in the home, or maybe outside in your own yard or in some designated place that's outside. Some people are upset about that, but we're pretty progressive here in California. You just have to go over to Nevada, other states, and they don't give a damn. They'll let people smoke anywhere. In front of your children, in the casinos. Actually, I think they got rid of smoking in the casinos in Nevada. Last time I went, that was not allowed anymore. But you could still smell the smoke everywhere because the what do you call it? The ash from people smoking is all over the carpets. There's a lot of carpet in those casinos, and I guess they have not changed them. So you can still smell it all over the place, but you're not allowed to smoke in the casinos as well, at least in the ones that I went into. So I don't know about Nevada, if they passed the law there, or maybe it's just the casinos. Probably just the casinos, because, you know, it's good for business if people don't smoke in there. But yes, smoking is really bad. Use of, you know, all sorts of drugs in general can cause babies to be born early, to be born low birth weight or small for gestational age. And poor maternal nutrition. If the, you know, soon-to-be mother does not eat properly, does not get the sufficient amount of nutrients or the right kind of nutrients, the baby can, you know, be born small for gestational age. Okay, they didn't get enough nutrients. When you are pregnant, you should eat, you know, let your body tell you basically how much you should eat. If you're hungry, that means you need to eat. You shouldn't try to starve yourself because you don't want to gain that much weight. Just your body will tell you. If you're hungry, that means you need to eat. You'll actually get cravings for certain things, and it's different for different women. But it's not true that you need to eat twice as much because you're eating for 2 or something like that. And of course, you shouldn't eat less than you normally do. That's bad, okay? I will tell you in general that women who are thin and then get pregnant will gain more weight because they're thin to begin with. And if they're gonna have a normal, healthy baby, they're gonna have to gain some weight, and they will gain more than women who are normal weight, or women who are overweight will actually gain the least amount of weight, because when, you know, they get pregnant, they don't really need to gain any weight. So that's something that's interesting there. There was actually a woman who, this has happened many times, who was overweight, and she went skiing, and when she went on her ski trip, she had a baby. She didn't even know she was pregnant. So that happens. And there you see a baby that's small for gestation. As you can see, the baby is really small, just slightly larger than that man's hands. Teratogens. Teratogens are things that can cause problems, can cause birth abnormalities. And they could be anything, really. It could be viruses, drugs, chemicals, stressors, malnutrition. It can be anything that causes birth abnormalities, anything that causes problems. There are behavioral teratogens, which will harm the prenatal brain, and they'll affect later intellectual and emotional functioning. So there are teratogens that will directly affect the brain, and then will basically decrease learning or slow down learning, decrease intelligence, and even the ability of the child to regulate themselves emotionally, which will lead to behavior problems. And the timing matters. Teratogens, these things that can cause harm, they cause, the harm they cause varies depending on when the exposure is, okay? The brain is always, developing. So a lot of teratogens can actually affect the developing brain, but there's some teratogens, for instance, that can only cause harm during a certain amount of time, during a certain period of time, okay? And then beyond that, they don't really cause much harm, because what they affect, it depends on when development is taking place, okay? And so if that developmental window for that thing has passed, then that teratogen can no longer cause harm for that specific thing. There's also critical periods, time when a certain organ is most susceptible to teratogens. Okay, so this is just some terminology. Let's talk about some actual teratogens, and there are many, many more, by the way. There's a whole bunch, but don't drive yourself crazy trying to avoid everything. You cannot, but you do have to be careful. And here are some things that you really have to watch out for. Rubella, German measles. Hopefully you've received your vaccines. Because that's something that if you get and you're pregnant, that can cause problems, for your child. Your child can be born with a heart disorder, cataracts, be deaf. Oh, and I guess I haven't updated, I've updated these slides, but that term is no longer considered politically correct. Now we just forget the term for it, but you can call it cognitive deficits, learning difficulties. I've said this, I say this every semester. I have changed it already, and I upload it, and somehow the old file still shows up. Okay, but that's what they used to call it back then. But you get the point. Yes, rubella can cause all those things. HIV impairs the immune system, okay? HIV, human immunodeficiency virus, which can cause AIDS, okay? But HIV by itself, even without becoming full-blown AIDS, if it's passed on to the baby, okay, during prenatal development, will impair the immune system. Will slow the baby's growth. Babies that have HIV can also be born with a small head, and it looks really awful, by the way. I mean, it's like the top head of the baby is missing, like from the eyebrows up. There's not much there, and it's really sad when you see that. But and of course, those babies will have all kinds of problems. They will not be normal intelligence. Infected babies usually die by age 5. Okay, there's a 25% chance the mother will pass on HIV to the baby. Okay, so they need to test for all of that stuff. If you do have it, you need to tell the doctor, because there's drugs that they can use. There are things they can do to make sure that the HIV is not passed on to the baby. There's a 25% chance it will be passed on. And if that happens, there will be some severe problems. Toxoplasmosis is actually a bacteria that can cause brain damage, loss of vision, and again, cognitive deficits. Not that term. I swore I changed this thing. I really did. I guess it's still, still showing the old file. Weird things like that happen, especially when you try to do it with an iPad. You upload something and sometimes it still uploads the old file. Okay, so toxoplasmosis is actually found in cat feces, in cat poop. So if you're pregnant, you should probably have somebody else changing the cat litter or cleaning the cat litter. You can still do it, but you have to be careful. You should not be touching that cat poop. You should not be exposed to it, because it can contain that bacteria known as toxoplasmosis, which can cause severe problems. Thalidomide is an actual, it's actually found in pesticides that they used to use decades ago, maybe in the 60s and 70s. They used to spray this stuff on crops, and then these things would end up in the supermarket. People would buy them and would eat them. And then it turned out that babies were being born with short little arms and legs, stubby little arms and legs. Like most of the arm and legs weren't even there. So deformed limbs caused by thalidomide. They've since banned that. They can't use it anymore in pesticides. It's a very bad thing, okay, that they got rid of. We often don't know how bad certain things are until they cause problems. And then they have to do some investigation and find out what is causing the problems, because the babies will be born with those short limbs and they don't know what's happening. Eventually they traced it to thalidomide, and then they banned that. There's a whole bunch of other chemicals, by the way, that have been banned that can cause problems. A whole bunch of other teratogens that are just chemicals. Malnutrition, okay, impairs cognitive ability. See, that's the way it should be said, right? Not that other way. That's more politically correct. It depends on the extent of malnutrition. Severe malnutrition will lead to basically problems with developing brain, and will lead to more of those problems. We'll talk about malnutrition in general as a specific topic later on. Not today, next chapter. Tobacco, we already mentioned, will cause low birth weight, respiratory problems. One very important teratogen to mention, we have to mention specifically, all on its own, is alcohol. Because alcohol use is so common, just like tobacco, alcohol use is even more common. Alcohol consumption during pregnancy can really be dangerous. It can lead to what's called fetal alcohol syndrome. Now, see, I tried to upload the new PowerPoint here, but you can see I have an extra space there between those two words there, between facial and features. And that tells me that, basically it's still the old PowerPoint because I fixed all that stuff. So alcohol, if you consume alcohol during pregnancy, that can lead to fetal alcohol syndrome. And there's a variety, of symptoms, but some are very noticeable, like those abnormal facial features. You can see that this child over here that has fetal alcohol syndrome does not look normal. They have an elongated face, kind of a thin upper lip, a large gap between the upper lip and the nose, almond-shaped eyes, and they will have cognitive deficiencies. They will have problems learning, lower intelligence. It's very bad. However, I will tell you that the severity of fetal alcohol syndrome can vary. Okay, severe fetal alcohol syndrome will lead to severe problems. Okay, and you could even have a child, you can have a stillborn. It means the child isn't even born. I mean, isn't even alive when the child is born. Or you can have mild fetal alcohol syndrome. You can have children that basically you won't even be able to tell if there's anything wrong with them, and their intelligence can be otherwise normal, but they might have some slight facial features. I've actually had students that have told me that they have fetal alcohol syndrome, and I couldn't tell. They had a very minor form of it. So the severity can vary. That's fetal alcohol syndrome. No amount of alcohol consumption is safe during pregnancy. Usually one drink is not going to harm developing child, during prenatal development, but you want to avoid it completely. But if you're an alcoholic and completely addicted, that can be hard. Just like if you're addicted to smoking, it can be hard to stay away from that. Other things we need to look at. So when this newborn is born, they will also do, they will check other things, like they'll check reflexes for the newborn. And one common assessment that they use for that is the Brazelton Neonatal Behavioral Assessment Scale. It's a test that measures responsiveness, the responsiveness of the newborn, and they record, or they look at 46 different behaviors, including 20 reflexes. And here are some of them. Okay, actually, here's some images before we talk about the specific reflexes. So you can see over here, the newborn, it says the first movements are not skills, but reflexes. And reflexes are involuntary responses to a particular stimulus. Reflexes are things that are basically automatic. You don't have to learn them. You can see there the first image on the lower left, the child has a stepping reflex. Okay, the child can't walk, but if you hold the baby upright, the baby will move the little legs as if he or she is walking. The middle picture there is demonstrating the palmar grasping reflex. Newborns are able to grab from the very beginning. So if you put your finger in their little palms, they will grab them, and you can lift them up like that. Just be careful that you don't drop them, okay? Because they're not that strong. But yes, they are capable of grasping. And then the third picture there on the lower right is the sucking reflex. Yes, they're capable of sucking and swallowing from the very beginning. They're born, ready to survive, ready to breastfeed. So here are here's more information about those reflexes. So some of them, aid survival. Some of them are directly related to survival. Like, there are some that maintain the oxygen supply. They, like breathing is a reflex. Doesn't have to be learned. The newborn can breathe from the very beginning. Otherwise, you'd have a stillborn. Okay, breathing, even getting the hiccups, sneezing, thrashing, those are all things that help the baby maintain the proper oxygen supply. There are also reflexes that help the baby maintain the proper body temperature. Crying, when they cry, they're communicating. They're telling you that maybe they're too cold, too hot. They're trying to get your attention. It could be because of body temperature. So that you can go over there and, and see what's going on. But they shiver. Shiver also helps maintain body temperature. They tuck in their legs when they're cold. That makes them feel a little bit warmer. Or they push away when they're too warm and you're holding them. They'll actually try to push you away because it's too warm and your body temperature is increasing their temperature. There are reflexes to manage feeding, sucking, swallowing. That's of course for for breastfeeding and even bottle feeding. But we'll talk about breastfeeding in general. And most infants are breastfed from the very beginning. Rooting is a reflex that a lot of you probably haven't heard of. Rooting is when, to demonstrate rooting, what you have to do is you get your finger and you touch their cheek. If you touch their right cheek, the infant, the newborn, will actually turn towards the right. If you touch their left cheek with your finger, they'll turn toward the left. And that is called rooting. And the reason that's useful is because when you put the newborn close to your breast as the mother, if they feel the breast on one side, they'll turn in that direction. and try to latch on, try to find the nipple. If they feel the breast on the other side, then they'll turn to the opposite side. It's helpful for them to find the breast, find the nipple, and start breastfeeding. And spitting up is also used to manage feeding. Newborns and even babies that are, several months old spit up very easily. If you feed them too much, too quickly, they will spit up. It's like they throw up, but it's not that severe. They can spit up what they've been eating, and they do it very, very often. Just so you know, it's going to be very messy feeding these newborns. Reflexes, other reflexes. There's other reflexes that signify that there's normal functioning. The Babinski reflex is a reflex. What you have to do here is that you have to stroke the baby's toes, or stroke the baby's foot, a foot, and you'll see that the toes will fan upward. Okay, their toes might be curled in a little bit. Take your finger and stroke their toe. Their foot, and then the toes will open up, like a fan. That's the Babinski reflex. That reflex does eventually disappear. It's present in newborns, but it does disappear eventually, except if you have cerebral palsy. For some reason, if you have cerebral palsy, that reflex does not disappear. My wife has cerebral palsy, and she still has that reflex, but it's supposed to eventually disappear. There's the stepping reflex, which I already described. I showed you a picture. Hold the baby upright, touching a flat surface. They'll move their little legs as if they're trying to walk. The swimming reflex, they can't swim, but if you lay them horizontally on their stomach, they'll move their little arms and legs as if they're trying to swim. Not quickly, okay? Not like they're really trying to swim, but they tend to move their little arms and legs. The grasping reflex, the palmar grasping reflex, I already mentioned as well. Put your finger in their little palm and they'll grab it. They'll grip it tightly. The moral reflex is basically like, it's like a startle reflex. Someone startles them, their arms will, they'll stretch their arms outward and then bring them together. It's a reflex. There's other things you need to watch out for. They are related to the newborn, but more having to do more with the mother. Postpartum depression, okay? Sadness or inadequacy that's felt by about 8 to 15% of new mothers. So 8 to 15% of new mothers can experience what's called postpartum depression. They can feel awful, depressed after giving birth. And the severity and the symptoms can vary. Symptoms can range from just having the baby blues. Basically, you feel like kind of down, not so good, but not awful, to postpartum psychosis, to feeling so awful that you want to take your own life, and you even want to take the life of the newborn. Okay, it can be really severe. There are things that can increase the severity or the chance of having postpartum depression. For instance, just caring for a baby is very burdensome, very stressful. They keep you up all night at the beginning. They need you around the clock. And it's just really difficult. And you need to get as much help as you can, particularly from the father. So baby care can be very, very burdensome, very stressful, and can increase thoughts of actually mistreating the infant. Those that have postpartum depression might have thoughts of hurting the infant. It's very frustrating, stressful, very difficult to care for a newborn. And those that have postpartum depression might have thoughts of harming their own children or their own newborns. Parental involvement, like I said, can be beneficial. Having the father can help, but fathers, can be actually depressed themselves. But it's good to have somebody help you in general. If you're all on your own, it can be very, very difficult. Causes for postpartum depression can vary. Some women, just like with depression in general, some people are naturally more prone to be depressed than others. They have a genetic vulnerability. It could also be caused by the stress or the very difficult situation of having to raise a child, particularly on your own. A variety of things, personality issues, but it is common and it's a real thing. And if you do have this or you think you may have that, you need to get help, because it's both your life and the infant's life, the newborn's life, which are at stake here. And it's very, very difficult already, even without having postpartum depression, to deal with a newborn. New fathers, it's not only fathers, but the entire social network and culture, they're all crucial influences. So the father should be involved if the father is around. Now, with the kind of dysfunctional society that we live in, there are many times when the father is not around. But the father should play a role, okay, if the father is around. The father should be there, okay? Just being there is important. But the father can help the mother stay healthy, make sure that she's basically getting enough sleep, that she's eating properly, because when you're taking care of a newborn round the clock, you may neglect yourself, okay, and your needs. Helping the mother manage the stress, taking care of the baby, holding the baby, bottle feeding the baby. It doesn't always have to be breastfeeding, okay? Providing legal acceptance, just the father saying, yes, it's my child, right? That can be very helpful. There are many fathers, however, that will deny that that's their child, and will say that it's not. That, of course, is not very helpful and very difficult, stressful for the mother. Mothers should involve and encourage fathers as much as they can. As the mother, the baby will need you more, right? The baby will need to be breastfed, the newborn, around the clock at the beginning. And then eventually, you'll get into a pattern that will be more convenient. But around the clock, and will, wake you up and frustrate you, and, that baby will cry and scream and poop and pee on you and all that stuff. Fathers can help out as much as they can, changing those diapers, bottle feeding, holding the baby, comforting the baby, helping, rock the baby to sleep, all those things. They can help a lot. But it's still very, very burdensome for the mother. They're the ones who we're going to have to deal with most of what happens. I'm not sure how to pronounce that. Kavad, I think it's pronounced. Those are symptoms of pregnancy and birth experienced by fathers. Sometimes fathers will behave as if they're pregnant too, and they will also gain weight. Or they can also may not allow themselves to be stressed out because they are, acting as if they're pregnant and they have to be, watchful or something like that. Sometimes that can happen, which is a weird thing, but it's a kind of empathy. Parental Alliance. Here's the thing. You want a parental alliance. Raising a healthy child, raising a child in general, requires the work of a lot of people. Primarily the mother, of course, but the father should also be involved. Okay, but also grandparents if they're around and can help. Even siblings that you have, brothers, sisters, all those people can help and help you out, relieve you of this, relieve you for a while. It's very difficult to raise a child, and the more people you have around you who can help, the better it is. Even if you have older children, sometimes parents will have children of different ages, and you can have teenage children already, or even or even children that are grown, and then you have another one, okay, a newborn. They can help a lot. That's the case for my brother. He has a 15-year-old daughter and a 16-year-old daughter, and he had a son, after that. And now they're raising this son, and he's at the age of my son now. He's about 7 years of age. But yeah, those teenagers can help a lot. The oldest daughter is now in college, like 18 years old. So yeah, they were about 15 and 16 at the time. Not at the time, actually, they were a little bit younger than that, but they were able to help a lot. They don't have to be teenagers to help, but if you have children who can, help a little bit, they should help. Just make sure that they're capable. Okay. I wouldn't have a 5-7-year-old helping, but a 12-year-old, 13-year-old, they can help. Okay. Just make sure they're careful. Family bonding, parent-infant bond, of course, is very important. Bonding involves a strong, loving connection that forms when a parent holds, examines, and feeds the newborn. Okay. The mother and newborn will form a very strong bond. There's no bond like that bond between the mother and child. The father will also form a bond, but not as strong as the one with the mother usually, because the mother is needed more. Okay. So usually the children are closer to their mothers than they are with their fathers right from the very beginning. But that's a parent-infant bond that forms, and this is a form of attachment that will continue, and we'll talk about that. We'll talk attachment specifically later in the semester, actually pretty soon. And there's something known as kangaroo care that is helpful, but not necessary. Kangaroo care is when you rest your baby on your bare chest, have that skin-to-skin contact. It's not essential. You don't have to do it. It's not required. Baby will be fine if you just have normal contact over the clothes, but it will help that human bonding for them to feel your skin, your warmth, and you feel their warmth. And even fathers can do that. But of course, that happens with the mother when you breastfeed as well. But that's all part of bonding, okay? You know, holding your infant and, you know, feeling them next to you and them feeling your skin, all that stuff is helpful. And you'll want to do that instinctively anyway, okay? It's just a very good feeling when you have that infant and you're holding that infant. You feel like there's nothing more important in the world. And as a matter of fact, I can tell you, as a father myself, that there's nothing like the love that you have for a child, right? Maybe you don't have children yet, but you have a significant other and you love them and you think that you can't possibly love someone more than you love that person. You'll see when you have children. Yes, you are capable of more love. You usually love your children more than you love your spouse and your significant other, because they mean everything for you. You'll do anything for them. Now, will you do anything for your spouse? Maybe, okay? But there's nothing like the love between a father and child or a mother and child. Being a parent that's one of the strongest bonds that exists, the bond between parent and child. Okay, I will stop there.